Good morning, everybody. Very warm welcome to all of you to this conference on enhancing trade and health sector between India and Pakistan. This is being done in collaboration with SDPI, as you notice on the backdrop, and of course, ICRIER from here. Dr. Arun Kumar Panda, Additional Secretary, Department of Health and Family Welfare, Government of India. Mr. B.K. Rao, Chairman, ASSOCHAM Council on Healthcare and Hospitals, and former Chairman, Sir Gangaram Hospital. Syed Yawar Ali Sahab, who's been a great friend of ICRIER, and I've been seeing him in ICRIER for a number of years. He is the Chairman of Nestle Pakistan Limited and co-chair India-Pakistan Joint Business Forum. Mr. Ravi Beg, former President, PSG Chamber of Commerce and Industry in India. Ladies and gentlemen, a really warm welcome to all of you who've taken the trouble to come here this morning to engage in this conference. I heartily welcome especially the Pakistani delegates who represent here hospitals, academic institutions, and government. And I also warmly welcome the Indian participants from industry, academic institutions, and government. ICRIER, the Indian Council for Research on International Economic Relations, has been working on India-Pakistan trade, as you know, for a long, long time, since at least 2004, when we established the South Asia Research Focus Area within ICRIER. And over the years, because of our work in South Asia and because of our work in other areas of economic policy, I'm happy to tell you here this morning that we have been ranked as the premier think tank influencing policy that has a direct impact on policy in India. And this is, as you know, a ranking that comes out from the United States. It's an independent ranking of think tanks, over 1,000 think tanks across the world. So we are happy that our efforts have been recognized, and we shall, of course, continue to deliberate and work on these themes. Some of you, as I said, have already been associated with our work on India-Pakistan trade, which has been spearheaded by our Professor Nisha Taneja. And we have established a separate portal for all our work on India-Pakistan trade. And what is interesting and exciting about that portal is that not only does it reflect our work, but it collects all work on India-Pakistan trade, and you will find it as a one-stop shop for research and knowledge and evidence of trade between India and Pakistan. And the reason why we engage in this area, of course, because immediate neighbors, therefore South Asia is important. We are also working with our other, on research with our other South Asian neighbors. But we firmly believe in ICRIER that trade can be a powerful mechanism for conflict resolution. And once we are vested in trade, then we think that it will become even more difficult. The opportunity cost of engaging in conflict will become that much higher. And therefore, we have created several platforms at different levels for dialogues. And you know, there are a number of dialogues that we have between India and Pakistan, roundtables. And ICRIER conducts a number of these roundtables. There are newsletters that we put out, and we've had an annual conference since 2013. And today is our fourth conference on the specific topic of India-Pakistan trade. We've also had eminent people from Pakistan to come and deliver lectures in those conferences. We've had a distinguished lecture series, and I've seen many of you in those lecture series. I remember the names of Ishrat Hussain Saab, who delivered a lecture, Zafar Mahmood Saab, who was the former Commerce Secretary in Pakistan, who's delivered, and in collaboration with Rahul Khullar, who was our Commerce Secretary at that time, and they delivered a distinguished lecture as a part of our India-Pakistan trade work 2 years ago. And so I think the considerable amount of work that has been done on India and Pakistan and the number of people that have been associated with the platform that has been afforded by ICRIER, I think has been able to create a positive discourse around trade. And that's, as I said, our ultimate aim is to build evidence, to create knowledge, create a positive discourse so that we can normalize our relationships. And the topic of our previous engagement on Pakistan was normalization of India-Pakistan relations. This year, we've begun to work deeply in the area of the health sector between India and Pakistan, and I'm really happy to say that, again, just like our previous work, this work is also attracting a lot of attention, and there is huge potential for trade in the health services between India and Pakistan, given the demand side as well as the supply side, and I'm sure we'll be able to see a lot of positive movement in this area. For this conference, we are collaborating, as we have in the past, with an institute in Pakistan, and our collaborator for this workshop is the Sustainable Development Policy Institute, SDPI, which, as you know, is based in Islamabad, and we've had previous collaboration with SDPI, and there are, I'm happy to say that we've had a very good professional relationship with them. This conference is being supported by the PhD Chamber of Commerce in India and ASSOCHAM. And we are grateful to both these institutions for not only supporting this workshop, but being represented in this conference today. And I'm sure that the deliberations today will highlight the prospects of trade in the health sector and will suggest mutually beneficial outcomes. And before I end, let me say, could I request all of you, and you're experts in this area, and therefore you're here, may I request all of you to kind of engage and make it more of an interactive session, and whatever suggestions you have, you can give to the researchers so that we can bring that to the table, and we can take that to the policymakers as the case may be. For enhancing trade between India and Pakistan, not only in the health sector, of course, health is a manifestation of, I think, a greater relationship that we can have between India and Pakistan. So with these words, once again, I extend a very warm welcome to all of you for having come here, especially, as I said, our Pakistani delegates who often make a circuitous trip to Delhi and endure long flights to get to Delhi. And I hope that will change in the near future, not in the medium term. I hope that changes in the short term. So really a warm welcome to all of you. Thank you so much for coming. And may I now request Professor Nisha Taneja to make her presentation. Thank you.
Good morning, everyone. As always, it's a pleasure to continue to work on India-Pakistan trade. So why did we select the health sector for India-Pakistan trade? Now, this is a sector in which trade can only be a win-win situation for both countries. And this sector has a strong humanitarian angle. Fortunately, there's been only positive reporting by the media in this sector in both countries. In fact, very often we've seen very heartwarming stories make headlines in different newspapers. Also, not much is known about trade in this sector, and therefore, we thought it would be important to identify opportunities and challenges and areas of collaboration in this sector. Now, the health sector comprises of several segments, and it includes both goods and services, though the largest potential lies in medical tourism or medical value travel. There are also opportunities for India in pharma sector and for Pakistan in the surgical instruments and medical devices segment. So how has India emerged as a medical tourism hub? Basically, India has been able to offer good quality healthcare at affordable prices. And we've tried to compare prices of different treatments across different countries. And you can see that India is cheaper than a lot of the other countries. Also, India has several internationally accredited programs. Right now, there are 28 internationally accredited programs. And we also have a domestic accreditation body called the NABH. And this body is an institutional member of the International Society for Quality in Healthcare, which is an international body which grants approval to accreditation bodies. And what this means is that the standards set by NABH are in line with global benchmarks. and the hospitals therefore accredited by NABH have international recognition. And currently there are 394 NABH accredited hospitals in India. India also has a good, skilled and a highly qualified doctors workforce, and there is also a good paramedical staff, good technology and infrastructure, also a more holistic approach which including allopathy, other forms of healthcare like Ayurveda, yoga, naturopathy, Unani, Siddha and homeopathy. Also for SAARC countries, a pull factor is the cultural and lingual similarity, and good air connectivity with the major cities in India is another factor. Now, we also tried to go into the details of medical tourism between India and Pakistan. And what we did was to conduct a survey, and most of the findings are based on the survey. India's major medical tourist base lies in the African continent, Eastern Europe, Middle East, and the SAARC countries. Now, the SAARC region accounts for 50% of the patients, and of these, Afghanistan accounts for 50%, Bangladesh accounts for 30%, and the other SAARC nations together account for 20%. Now, this is really based on the survey that we did. Data on medical tourism is not available. Even though there are definitional issues, the data on medical visas can be used to assess the size of the market. This has not been done so far. Whatever findings we have are based on our survey. Now, most patients from Pakistan come to the Delhi NCR region, and that too in a limited number of hospitals. And a small proportion go to Mumbai, Bangalore, and Chennai. The disease burden is liver and kidney transplant, cardiology, and infertility. Now, how do patients in Pakistan get to know about the treatment being offered in India? There are medical tourism assistant companies or facilitators. Some of these facilitators are organized and others are very informal. For instance, there could be some ex-hospital staff which has knowledge about medical tourism, and then they therefore start providing information on how treatments can be offered and where they can be offered. Or there could be other informal ways of getting information through on medical tourism. For instance, the word of mouth from friends and relatives who have received treatment in India is also another way. Joint camps have been held between Indian doctors and Pakistani doctors, which has created awareness on the treatments available here. For instance, just last year, there was a joint camp at Dr. Ziauddin Hospital. Also, there are some private hospital tie-ups with government. For instance, the Children's Hospital in Lahore has a tie-up with 2 hospitals in India. Not many people are aware of this. Also, hospital websites and hospital referrals are a source of information. Government website, for instance, the recently launched India Healthcare Portal is also a source of information. Now, most patients do not have any kind of insurance, and the mode of payment is largely in cash, which might be hand-carried, or it is brought through informal channels, and in some cases, the money is transferred through the embassy. Most of the patients are inpatients or IPD patients, while OPD patients are very few. This is unlike Bangladesh, where a larger number of patients are actually coming through OPD, and that too through a tourist visa and not a medical visa. Most of the patients also, the medical visas are introduced to facilitate patient and attendant movement. In some cases, we have found in the survey that visas have been granted within 24 hours, but in other cases, there are inordinate delays. The average time for grant of visas we found was between 4 to 7 days. Now, what are the constraints to India-Pakistan trade? Consumers don't have information on hospitals, doctors, treatment, and places to stay. The web portal that we have is new and awareness is limited, even though the website is actually displayed on the Indian High Commission website in Pakistan. There are too many documents that are required for the medical visa. Also, the FRRO registration is an additional burden. Banking channels are limited and not accessible. Visas are limited to a single city and a single attendant, and there is limited flight connectivity. Direct flights are only there to Mumbai and Delhi with poor frequency, and there are no Indian carriers between the two countries. So we also tried to compare with other South Asian countries, and we found that time given for FRRO reporting varies between countries in South Asia. The number of attendants who get a visa also varies. Fees paid for medical visas varies across countries. This doesn't necessarily mean that it is highest for Pakistani patients. Pakistan is somewhere in between, with some countries having to pay more and others having to pay less. A number of documents also varies across countries, and there is no city-specific visa for other South Asian countries except for Pakistan. So we tried to do a comparison of the documents required for the medical visa across the South Asian countries, and as you can see, it varies across countries, and the highest number is for Bangladesh, and Sri Lanka and Pakistan follow next with 6 documents each. We also tried to then see how does India compare with other Southeast Asian countries. And we can see that in South Asia, that Thailand is a leading provider in Southeast Asia of medical tourism services, followed by India, and Singapore and Malaysia follow next. So what can India learn from the Southeast Asian countries? Now, other Southeast Asian countries have more internationally accredited hospitals. For instance, Thailand has 41 compared to India's 24, but Singapore and Malaysia have 10 JCI accredited hospitals. Also, the number of documents required in Southeast Asian countries is less than India, and there is no requirement of FRRO registration in Southeast Asian countries. In fact, just this registration it kind of nullifies the purpose of having a medical visa, because the whole idea of having a medical visa is to facilitate movement of people. But this additional requirement actually worsens the whole, it doesn't really give credence to the medical visa, the purpose of the medical visa. Also, in Southeast Asian countries, there is better connectivity and better infrastructure. Next, I come to exports of pharmaceuticals from India to Pakistan, where we think there is potential, and we try to compare medicine prices in India and Pakistan. This was a joint survey that was conducted by ICRIER and SDPI, and we can see that several drugs are cheaper when imported in Pakistan when imported from India, and the price difference ranges between 1.1 times to almost 12 times. Current exports from India are $213 million, whereas the potential stands at $650 million. There are 35 items on Pakistan's negative list, which means that these items are not permitted to be imported. And if these are removed, cheaper drugs can be provided. In fact, in a recent ICRIER study, it was estimated that informal trade in pharmaceutical products is about $83 million. And the danger is that low-quality medicines, or sometimes even spurious medicines, find their way into the Pakistani market in the absence of any quality control. Next, we come to Pakistan's export potential of surgical instruments and medical equipment to India. Not many people are aware in India that Pakistan is very, very competitive in this segment. It's globally competitive, but the imports from Pakistan into India are very low. Currently, it is only $11 million, whereas the potential is $321 million. Pakistan is globally competitive, but India does not import these items from Pakistan. And India and Pakistan should actually enter into a mutual recognition agreement so that these items can be imported into India. So what is the way forward, and what are areas of cooperation? Firstly, medical visas should be used as a source of collecting data on medical tourism in India. This would help in making appropriate policies for medical tourism in India. Also, India should spread awareness on available healthcare facilities. The new web portal needs to be publicized. India should reduce documentation required for medical visas, and also the number of documents across countries should be synchronized. These steps would be in line with India's initiatives to improve the environment for doing business. And none of the countries, Southeast Asian countries like Thailand, Malaysia, and Singapore have a requirement of FRRO registration. India should reconsider this policy. Pakistan is in a nascent stage of developing its medical tourism industry, and there could be joint collaborations in this area between the two countries. Telemedicine diagnostics is another area in which both countries can benefit if they collaborate. Collaborations in developing accreditation programs can also help in strengthening the sector. Pakistan should consider removing pharmaceutical items from the negative list so that informal trade is curbed and consumers have access to better quality medicines. India and Pakistan should enter into MRAs so that Pakistan can export surgical instruments and medical devices to India. Biopharmaceuticals has been the top R&D investing sector in the world in recent times, and the two countries can integrate and collaborate to set up R&D facilities. In the area of traditional medicine, again, there is bilateral trade potential and mutual interest in developing standards. Thank you.
Thank you, Nisha. May I request Shahryar Khan Sahab, Research Fellow, SDPI, to make his presentation.
Thank you. This is the study which we conducted in Pakistan, largely driven by the purpose and the scope of the study, which I'm going to elaborate now. Health tourism and trade in health sectors across India and Pakistan has not gained prominence in the recent past. There exists limited information on the flow of patients across both countries and difficulties encountered by both countries in promoting and institutionalizing health trade. Scope of the study was, it had two domains. The first one relates to medical patients traveling to India for the purpose of medical treatment. And the second was pertains to briefly engages with the pharmaceutical and surgical trade across both countries. There were three primary objectives of this study. The first one is to identify key challenges and bottlenecks in cross-border delivery of health services. The second one is to identify key reforms and policy measures for encouraging and formalizing health trade between India and Pakistan. And the third one is to reflect on the increase in health services trade with India and how it can have a favorable spillover effects in pharmaceuticals and surgical goods industry in Pakistan. We adopted the following methodology, which consisted of perceptions and opinions of doctors, professionals, private sector entities, state officials, patients, businessmen, traders for examining difficulties faced by medical patients in Pakistan traveling to India for medical treatment. And we selected three studies for this study: Lahore, Islamabad, and Karachi, because these are the main cities in Pakistan, and mostly the patients, they travel from these countries to India. We also reviewed a selective body of literature, which basically informed and guided our study. And you can see the authors that we have listed there. Some of these authors are here. We adopted, these two kind of approaches we adopted while we conducting the data. The first one was in-depth structured interviews that we conducted with Commerce Ministry, doctors and CEOs of public and private hospitals, and personnel of pharmaceutical and surgical companies. And we also there was an informal interview with an agent who facilitates patients in Pakistan acquiring health treatment in India. So these are the key barriers and major findings. Of course, the first one, as you would see, it's the visa problem. Health trade under Mode 2, consumption of health services, is of restricted nature, primarily because visa regime patients encounter delays and complications in acquiring visa for medical purposes. It is more of an inadequate information. Consumption of health services is limited by informational inadequacies about health services in Indian hospitals, and reliability restrict the trade in health services to a greater extent. Of course, it is also about financial transactions, because health services consumption is restricted by financial limitations. Paying for health services restricts patients' choice and create dependency on third parties and informal channels of transactions. And now I'll come to the complexities in pharmaceutical trade. It's a real complex, because when we talk about pharmaceutical trade, several factors has to be borne in mind, and such as protection of industry, non-tariff barriers, weak intellectual property rights, and lack of interest in the industry of Pakistan from importing Indian drugs. It's also about the prices and affordability. Since medicines are procured and distributed by the government in Pakistan, they're not affordable by consumer, especially in the rural areas. Here is an example of what is this cost conundrum. Consumer in Pakistan roughly spends $10 on drugs compared to an Indian who roughly spends $4. Now, how can trade in health services be promoted between two countries? What can be done? Here are some of the prospective areas for enhancing health trade between India and Pakistan. Transfer of technology and specialisms such as telemedicine from India can promote health trade, especially in primary healthcare. Under a bilateral agreement, health professionals and students should be encouraged to acquire access to latest health intervention and practices. To foster enhanced medical tourism, patients seeking treatment in Indian hospitals may be extended preferential treatment by easing visa regulations and taking measures such as intra-bank transactions. Indian hospitals should be recognized to take advantage from clinical advancement and healthcare services. And also establishing institutional linkages. I think this is one of the potential areas for making progress in health trade between public and private hospitals, especially across both countries, can tremendously contribute to health tourism and exploring health trade in areas currently unexplored. Health institutions and research organizations can also undertake joint research in areas such as kidney and liver transplant, post-operative techniques, and primary health care. Under the ambit of health tourism, cross-border flow of doctors and medical students can be greatly encouraged. Special seminars on health tourism and other interventions should also be promoted and institutionalized in both countries. Now, here are some of the practical steps for promoting health trade. The first one is formalizing health trade by removing key obstacles and establishing facilitating desks across major cities. This is one of the key findings that came out from this research study, that as the people we interviewed did not have information about how to go about treatment and how to get information and from where. Also establishing coordination between the concerned ministries, because this sector does not really operate strictly by the embassies in both countries, but also there are other institutions involved, such as regulatory bodies, banks, and private sector institutions. Encouraging private sector is also a potential area in which health trade can be developed. Formal linkages with private hospitals across both countries. Joint working groups on pharmaceuticals and surgical groups may be convened to encourage businessmen for joint ventures in pharmaceuticals and surgical subsectors. Policy coherence explores a policy option that does not jeopardize or undermine national health objectives, intellectual property rights, and interest. A task force may be set up by the ministerial level to formally or informally initiate the process of crafting a health trade policy. Thank you.
Thank you. As you know, the Indian Parliament is in session and there's lots of debates going on, so the Minister has regretted his inability to come, but we are delighted that Dr. Arun Kumar Panda, who's the Additional Secretary in the Department of Health and Family Welfare, Government of India, is here and will now give his special remarks. Thank you, Dr. Panda.
Good morning to all friends from India and especially from Pakistan. It's an absolute delight to be with you and to kind of to be able to learn from you and from your presentations. Mr. Kathuria, Syed Yawar Ali Saab, Dr. Rao, Mr. Shahryar Khan Saab, Professor Nishat Taneja, and friends. Our Honorable Minister has expressed his inability to come, as Mr. Kathuria just mentioned, that because the Parliament session is on, and so at the last moment, like, he had to express his inability to come. And that gave me this opportunity to come here and to kind of to share with you some of our thoughts and to also be able to really learn from this. And first and foremost, I would like to really congratulate ICRIER and SDPI, who have come forward with the help of PhD and ASSOCHAM to actually organize this kind of a conference where, first of all, at least we would each side would actually know from the other side what are the difficulties that the people from both these countries are facing in this kind of a very, very important area of health and healthcare. We generally come across very many stories in the newspapers, where children come and there are liver transplants, there are organ transplants, there are other things which take place in some hospitals in Delhi and sometimes in Mumbai and other places. I believe there's a huge potential, as has been pointed out in both the presentations. By the way, I must congratulate both Professor Taneja and Ms. Khan Saab these are excellent presentations where they have actually come up with very specific recommendations and which should be taken very seriously by both governments, by both countries. If you really look at the health sector, let me just share a few thoughts about the health sector in India. How it's what's happening. As you know, when we actually started after independence, it was primarily a public sector driven and a government driven health sector. But gradually, now if you see, almost 70 to 80% participation and is coming from the private sector in the health sector in our country. So that's a huge increase by the private sector participation in the health sector in this country. And that you can see even in the smaller, semi-urban places also you will see nursing homes and, private hospitals and doing very brisk business. And that gives us a kind of, I would also like to, not just the hospitals, but look at the pharmaceutical sector. We are now the third largest producer of medicines and drugs by volumes in the world, third largest. We export to almost more than 200 countries, and I'm talking about the medicines. And as far as the vaccines are concerned, we are now exporting to more than 150 countries. I was told that the measles vaccine, actually manufactured by Serum Institute of India, almost every third or fifth child in the world gets immunized against measles by the vaccines of the Serum Institute of India. That's the kind of expansion that these institutes have gone. And there are many companies which are WHO pre-qualified, and there are huge exports to developed countries like US and European Union and many countries. If you look at the growth of the sector, it was almost 14% growth. We had problems in some other sectors sometimes, but the health sector kept on growing at 14%, and it is expected that maybe in the next decade it's going to touch almost 21% annual rate of growth. Which are the areas where the growth is most prominent, most visible? First, of course, as I just mentioned, is in the area of hospitals, both tertiary care hospitals, big hospitals. You can see in Delhi itself, you can see a very, very large number of those hospitals, like right from Apollo Hospital and Max Healthcare and Fortis and you name them, and Medanta in Gurgaon, and in many such different groups are there. The second, of course, is the pharma sector, as I just mentioned. I can share something with you that whenever we have discussions with very many in the joint working groups with many countries when we discuss about health collaboration. One thing which keeps coming up again and again and again, unfailingly, in every such discussion with every such country is the collaboration on the pharmaceutical sector. Because even from Philippines right up to the other countries, there's one sector where actually these countries want to really collaborate with India, because you might be knowing that before Cipla, which is a company in India, came up with the generic version of the antiretroviral drugs to treat HIV, the cost actually came down by more than 90%, by 99% almost. Otherwise, things would have been absolutely unaffordable by, even in many, many countries. I can share something with you if you have time. In fact, we had the UNAIDS conference where the executive director of the UNAIDS came, and in his speech, I heard him speaking in Vigyan Bhavan. He said, when I came from my country, he was from Africa, I think from Nigeria or somewhere. He said, I was told by many people in my country that if you are going to India, please, please, please convey our congratulations and our best wishes and our and thanks, gratitude to the Indian companies which have actually manufactured these drugs at, at almost nothing cost, which has actually made us, which has enabled us to survive the HIV patients and all that. Apart from that, if you see now, say for example, hepatitis C. Now hepatitis C is becoming a big killer all over the world. Now I was told the Drug Control General of India has given permission, has license for the manufacturing of the new generic versions of the hepatitis C drug in this country, which is going to bring down the cost tremendously. And apart from that, if you look at the biosimilars, for example, the biosimilars, which are very complex compounds, are also, the cost is coming down drastically because the generic versions are coming up, the biosimilars are coming up in this country. Now this is another area. Medical equipment also, there is a huge scope also for the medical equipments also to kind of, to progress and to expand. And I was, in fact, it was a very big, kind of very pleasant, I was very, very pleased to know that Pakistan is doing very well in the area of medical equipment and appliances and all that. That's very, very good news. Now, if you look at the broad achievements in the health sector in this country, the one thing that I would like to really first point out is the huge achievement in the area of polio eradication. Now, India had the maximum number of polio patients in the whole world. Now, a few years back, nobody had ever imagined that India, with its complex terrain and, all those huge area and all that, with all these resources and all the constraints, would be able to really eradicate polio. This was almost like scaling Mount Everest, I think something like that. And India could do that. This year, we have been able to also eliminate maternal and infant tetanus. That was killing a lot of mothers and children also. Yaws as a disease has also been eradicated and certified by WHO. I'm talking about the major, those eradication and elimination. If you look at the primary care, the secondary care and the tertiary care, before the National Health Mission was announced and launched in 2005, the central government used to do, there's not much which was being done from the central government. Not to that extent. The provinces and the states used to do that. But in 2005, I'll be very happy to share something with you, that the rate of decline, now this is important, the rate of decline in the IMR, infant mortality rate, and the maternal mortality ratio, MMR, and the TFR, the rate of decline has been sharper in India, than the global decline. The Millennium Development Goals, in many of such goals, we are quite sure that we will be reaching them, or will be very, very close to them, almost kind of, reaching them when the reports come out. Now we have the SDGs which have come, and that's kind of more comprehensive, as we all know, and we have a long way to go. By 2030, we have to do that. And as far as medical education is concerned, I would also like to share something with our Pakistani friends, that India, we do have a huge problem. Like, we need many more specialists. In our rural areas, in many places, we don't get doctors. They're not there, in some places at least. We have come up with certain things, how to do that, how to deal with these problems. But then I would like to also tell you that almost every year, 17 to 18 new medical colleges are being set up in this country. And these are not very inexpensive things. These are very, very expensive things, to set up these medical colleges. And currently we have almost 57,000 doctors are coming out every day. MBBS I'm talking about. And almost 26,000 PG. But we really want to enhance that from 26,000 upwards, because these days, everybody wants a specialist, a specialized doctor and all that. So that's the medical education that. And as has been already pointed out by Professor Taneja in her presentation, as you know, we had a department which was started some time back, Department of Ayush. It was called Ayush, AYUSH, A for Ayurveda, Y for Yoga and Naturopathy, and then U for Unani, S for Siddha. Siddha is actually a system of medicine which is practiced in one of the states in southern India, Tamil Nadu. And then, of course, H is homeopathy. Now, this used to be under the Ministry of Health and Family Welfare. The present government has actually made it a separate ministry for better focus and all that. Now, in almost all the new All India Institute of Medical Sciences which are coming up, you have one AIIMS, which was the original AIIMS, as they say, which was started in 1956 here in Delhi, which is the flagship tertiary care hospital and medical college in this country. But with that, we have now started setting up new AIIMS in other places of the country. And in all those AIIMS, I would like to tell you that we have started putting up a separate Ayush block, where there will be, so people can also access those services. So that's kind of, that's the niche area. And you can see the medical tourism, the international medical tourists who are coming to India, are coming in this particular area, especially Ayurveda and all that. And if you go to Kerala, and you can go and see, and how people are coming and what kind of industry is going on there. I mean, what kind of facilities and services are there, so that there is a long queue. You cannot just go and can see a doctor and get yourself treated. I mean, you have to first register yourself, because there's such a huge demand for those very, very, very high level of services. In fact, I would also like to share, I don't know, you might not be knowing, the present Honorable Chief Minister of Delhi actually had some problems. So he was advised by some, and he went to one of those institutes in Bangalore. And it seems, I mean, he had huge relief and improvement in all that. So all I'm saying is, this alternate traditional medicines and all that, this is actually playing a big role in health tourism. That's the point I'm trying to drive home. Cost advantage. It's very, very evident. It's apparent. I need not really talk about that. I mean, people who come to India, that's something that, those figures have been shown. Obviously, it's there. If you go to Max Healthcare, I mean, if you would like to just visit Max Healthcare, which is a private hospital. I mean, in fact, once I just went there, and I saw a lot of people from the West Asia, from African continent, and also from the West Asia. You can see them actually if you go there, the kind of facilities and the kind of services that they are getting. And now let's come to foreign direct investment. Now, FDI is also something which is an indicator of how well the particular area or sector is doing. You see, there has been a fairly, I would say, considerable growth in the area of hospitals, in the area of the pharmaceuticals, even the medical equipment, all these surgical equipments. There has been a lot of growth in the FDI also, foreign direct investment in this country. Though we need to really do much more than that. Healthcare portal already has been mentioned, and we would like to also, I would think that after this particular conference, perhaps both countries can take a cue from these recommendations, which are very clear and very, very specific, so that at least if we can work with that, perhaps both countries are going to benefit from this, their comparative advantage that they have, and people are going to get much better health services. And in fact, we have a common goal, and the common goal is to extend equitable and affordable health services to all our people, the citizens of these two countries. I mean, both countries have this And I take this opportunity to thank ICRIER and also SDPI that they have given us a platform where we can exchange, what is the best that we can offer to the other side, and also some kind of an opportunity to collaborate and to take this particular collaboration forward so that both countries and their people can benefit from this. Thank you. Thank you very much for your attention.
Thank you, Dr. Panda, for what you said was truly inspirational. And you reflected on the opportunities and I think several charming anecdotes, but you also identified the challenges. And I think those challenges should spur us on to greater movement in the direction of improving the quality of health services in India and of course jointly as well. So thank you very much for your address. May I now request Dr. B.K. Rao, Chairman ASSOCHAM Council on Healthcare and Hospitals and former Chairman Sir Gangaram Hospital for his address. Thank you, Dr. Rao.
Good morning. Mr. Arun Kumar Panda, Additional Secretary, Department of Health and Family Welfare. Mrs. Nisha Taneja, Mr. Rajat Kathuria, Director and CE ICRI, Mr. Saeed Yawar Ali, Chairman Nestle Pakistan. Dr. Vig will be joining us shortly, and Mr. Khan and other members present in this august gathering. First of all, I would like to extend a very warm welcome to all of you from ASSOCHAM. I would like to also congratulate Mrs. Nisha and Mr. Khan for the excellent presentation that they have made. In fact, they have covered most of the points, and then Mr. Panda gave a talk covering the other aspects which concerns the government. When it comes to the role of the chambers, what we are talking is a trade. And look at who we are and what we are. We are neighbors. We share a long border. We have the same disease burden. We are still struggling to make it possible for our people to have access to quality health care. And we are still trying to transform healthcare in our own countries. So while we are at that, we know that we have strengths and weaknesses, both in India and in Pakistan. And the strength that India has and the weaknesses that we have in our system were laid out to you in the presentations that I just alluded to. So when we talk of trade, we are talking of value. We are talking of the commercial aspect of that. That is where the chambers, think tanks like us, government, various platforms for the dialogue come in, and they are trying to set right whatever needs to be done to promote the industry, because right now we are more into the regulatory mode than into the promotion mode. But when it comes to the hospital care, that is one thing which we all agree is something which is a win-win situation, and that is something which goes beyond trade. It's just not the trade itself, because that is where, if you recollect, whenever the news comes about a Pakistani patient being treated in India, especially when it comes to a transplant, there is a sense of bonhomie, there is a sense of attachment that we are brothers, we are brother and sisters, and that is where that environment regenerates, and that is what we were talking of, an aspect which can be probably promoted to bring down the conflict between the two nations. Similarly, if we look at our other strength, as Mr. Panda said about YAS and the polio, as I said, we are similar. We have the similar work culture, we have the similar disease burden, we have the similar kind of terrain problems. So we can learn from each other in those areas also, which are much beyond the trade part of it. So I welcome all of you again here, and I'm sure that during the discussion we will be coming out with more suggestions which both the government, the private players, as well as the chambers can get involved into to promote what we can do for each other. Thank you.
Thank you, Dr. Rao. May I now request Syed Yaur Ali Sahab, Chairman of Nestle Pakistan, for his guest remarks.
Good morning, Mr. Sanjay Katuria, Mr. Arun Pandey, Dr. Nisha Taneja, Mr. Rao. I actually share something in common with you because I've been chairman of the Gangaram Hospital in Lahore. So, and Mr. Shehryar Khan, colleagues from Pakistan. ICRIER has been very proactive in the India-Pakistan trade. And they're always looking for new opportunities, breaking new grounds. And especially in the health sector is something which is an important sector and a doable sector for both countries. And I'm very happy to see that they have come up with some very specific recommendations and they've involved the stakeholders. And now they have set a very good platform to take it forward from here. There's a lot being said between the two, so I will I shall restrict myself to the work that we've been doing between India and Pakistan on the trade side. So, do I move forward? Is this how I move forward? Yeah. Okay. Let me just, for those who are not initiated by this, Pakistan-India Joint Business Forum, this was initiated from a meeting between the Commerce Secretaries of India and Pakistan in September 2012. And the idea was to promote trade between the two countries and involve the stakeholders and identify issues, number one. Secondly, how to resolve those issues, and then come up with joint recommendations to both the governments. And here I would emphasize joint recommendations. Sorry, we got the wrong side. Okay. Now, what we did was in our first meeting, we set up 10 task forces in the potential sectors and the sectors which had issues and problems. And, but they're not limited to 10, we can increase it further as well. Is the bottom one? Or? Okay, thank you. We come back to the, all right, thank you. So the ones, the prominent ones are agriculture, where in agriculture, and then secondly is textile, third is pharmaceuticals, culture, tourism, SMEs, auto and engineering, and now we're also considering one for the health services. And this was initiated by Dr. Trehan, who is part of our joint business task force, and along with Dr. Rashid Latif. And we've also had 6 meetings so far. So just to brief you, and our last meeting was in May, and I think the next meeting is now expected to be in November. So we meet almost every 6 months. And just to give you some of the work that has been done, in the agriculture task force, which was the most difficult sector, because agriculture has 3 main issues. One is the sensitivities, because we have 50% or more people on both sides that are involved with agriculture, so you need to protect the farmers. Secondly was the seasonality, because there are issues within seasonality. Sometimes you are producing more than the demand, and sometimes their supplies are lower than demand. And thirdly are the subsidies. So there was a lot of apprehension between the farmers in Pakistan that what would happen. But when they got together and they started talking, they found that there was a lot of new areas where they could collaborate on. And for example, they said that we would like to do whatever is best for the farmer and whatever is best for the consumer. And so they said, let's look at areas of collaboration in the seed business, in the agriculture equipment business, because India can manufacture agriculture equipment for smaller farmers. And also and they came up with a very interesting idea that Pakistan can export mangoes towards the latter part of the season, and we can import, let's say, Alfonso in the earlier part of the season. Similarly with quinoas, we can import quinoas in the earlier part and export quinoas in the later part. So actually it helps the farmers as well as the consumers. And so we are, in fact, now in November, there's a agro-tech exhibition in Chandigarh, where we want to set up 5 roundtables on 5 important areas. One of them will be seed, second will be on agriculture equipment, a third one will be on agriculture extension. How do you communicate with the farmers? And because there are similar farmers on both sides and smaller farmers. Fourth one will be on breed improvement, because our cows and buffaloes are producing maybe 1/8 or 1/9 of the top in US and Canada. And the fifth one, which is an important one, is on-farm water management. So we would like to come and exchange views on that. Now, these are some basic facts, and I think more the details will follow by my colleagues who are more specialists in this area. But Pakistan has 100 medical colleges, growing population, and 80% of the healthcare is in the private sector. There's also a regulatory body, which is the College of Physicians and Surgeons, and which sets the standards for training, evaluates the training facilities, and it's already been mentioned that the key areas, of course, are the visas. And here again, we do have a visa for medical tourism and an attendant, but sometimes that is not enough. So if you have a husband who needs treatment and you have a wife, she's not able to handle all the facilities. And then again, as mentioned earlier, where they have to stay, sometimes it's difficult. A major, I think, issue now is the connectivity. We have 2 flights from Lahore to Delhi by PIA and 1 from Karachi. And some of our colleagues spent about 12 hours coming via Dubai, and it's only a 50-minute flight going across the border, across to Lahore. And the banking channels, of course, how to move the funds, this is another issue. And I think 10 years ago, there was a agreement to set up 2 banks, Pakistani banks in India and 2 in Pakistan, but that needs to move forward.